Hello, I'm Dr. Adnan. Today, we will explore the range of possible causes for back pain. It will be beneficial in a number of other ways, in addition to daily practice and in exams. I'll focus on some of the most significant causes of back pain out of the many that exist. Let's start with the history taking. Elaborate the back pain first. We can remember with the mnemonic Socrates. S for sight, O for onset, whether it's sudden or gradual in onset, whether it presents all the time or comes and goes. C for character, R for radiation, A for associated symptoms, T for time course, E for exacerbating and relieving factors, S for severity or scoring from grade 1 to 10. After elaboration, inquire about associated symptoms. Based on elaboration, suspect few differentials and ask associated symptoms. Now past medical history. We will ask for history of similar conditions. Diagnosed with any medical conditions. Taking any medications including over-the-counter medication, any supplements or herbal medication. Allergic to any medications. History of hospitalization and previous surgery. History of any family diseases. Coming to the personal history. Elaborate diet, smoking, alcohol, physical activity, stress, recreational drugs, sexual history. Ask for TOL. T for travel, O for occupation, L for living condition including housing and with whom he or she is living. Plus, ask about driving, whether he or she drives any vehicle or not. In female, ask for 4 Ps. P for pregnancy, we will ask for current or any previous pregnancy. P for pills, means. We will ask for any contraceptive use. P for periods. P for pap smear. Asking every question would be unnecessary in history taking. Instead, only pertinent ones should be asked. Let's move to the differential diagnosis of back pain. The mnemonic cavitos helps us to remember the various causes of back pain. C for cancer, either primary bone malignancy, or secondary spread to the bone from different organs, like prostate, breast, intestine, liver, pancreas. Moving to A for autoimmune diseases like rheumatoid arthritis, ankylosing spondylitis. V for vascular conditions like abdominal aortic aneurysm. I for infection, urinary tract infection including pyelonephritis. T stands for trauma, intervertebral disc prolapse, cauda equina syndrome. O for osteoporosis, osteomalacia, osteoarthritis. And S for urinary stones. Let's now address a few important pathologies and the crucial questions we must ask. Starting with the urinary stones. Kidney stones, also called renal calculi, nephrolithiasis or urolithiasis, are hard deposits made of minerals and salts that form inside our kidneys. Very small kidney stone. They may even go undetected and pass out painlessly in urine. Larger kidney stones can cause symptoms including pain in the side of an abdomen or groin. Men may have pain in the testicles as well. Severe pain that comes and goes. It can radiate from loin to groin. A high temperature, feeling sweaty, nausea and vomiting, hematuria. Symptoms of urinary tract infection. Few important risk factors for kidney stones are family history of kidney stones, high protein diet, less fluid intake, some endocrine conditions like hyperparathyroidism, obesity, previous history of renal stone, some medications like diuretics, calcium supplements, some antibiotics like sulfonamides. Moving to the intervertebral disc prolapse. A prolapsed disc occurs when the outer fibers of the intervertebral disc are injured, and the soft material known as the nucleus pulposus ruptures out of its enclosed space. Symptoms of intervertebral disc prolapse are lower back pain, which commonly starts suddenly after lifting heavy weights, numbness or tingling in legs or feet, problems bending or straightening of back, muscle weakness, pain in the buttocks, hips or legs if the disc is pressing on the sciatic nerve roots, which we call sciatica. Straight leg test is positive on examination. If condition of intervertebral disc prolapse get worse, it can cause cauda equina syndrome. Symptoms suggesting cauda equina syndrome are numbness around anal region or genitals, lost control over urine and stool, lose feeling in one or both legs, got it after a serious accident. Let's now discuss one autoimmune condition, ankylosing spondylitis. Ankylosing spondylitis is a type of arthritis that causes inflammation in the joints and ligaments of the spine. 9 out of 10 patients are associated with HLA-B27 gene. The symptoms of ankylosing spondylitis, as usually, develop slowly over several months or years. The symptoms may come and go, and improve or get worse over many years. Usually first starts to develop between 20 to 30 years of age. Symptoms of ankylosing spondylitis are back pain and stiffness, which get worse in the morning and at night, arthritis of joints such as hips and knees. Enthesitis is painful inflammation, where a bone is joined to a tendon or ligament. Common sites for enthesitis are shin of tibia, Achilles tendon, under the heel, costochondral joints. Plus, it can present as fatigue, associated with other autoimmune condition symptoms. Let's discuss about urinary tract infection. The urinary tract infection is an infection of the bladder, kidneys or urethra. Symptoms are lower abdominal or back pain, frequency, urgency, dysuria, nocturia. Urine looks cloudy, dark or has a strong smell. Hematuria, fever, chills and rigors. In elderly patients, it can cause confusion or delirium. Risk factors for urinary tract infection are previous urinary tract infection, sexual activity, pregnancy. Older adults and young children are more likely to get urinary tract infection. Structural problems in the urinary tract, such as enlarged prostate, poor hygiene. Moving to the multiple myeloma. Multiple myeloma is a rare form of cancer, characterized by excessive proliferation and improper function of plasma cells, found in the bone marrow. We can remember symptoms of multiple myeloma as bone symptoms. Pain in affected bones, usually the back, ribs or hips. It's persistent and dull in nature. It can cause bone fracture and spinal cord compression. Symptoms of hypercalcemia, polyuria, polydipsia, confusion, abdominal pain, muscle spasm, nausea and vomiting. Cancer symptoms, loss of weight, loss of appetite, lymphadenopathy, low RBCs, low platelets, low WBCs. Causes anemia symptoms, unusual bleeding, and repeated infections respectively, and renal failure symptoms. Finally, let's discuss red flags. High temperature, cloudy and bad smelling urine, numbness around bottom or genital area, not able to pass urine, confusion, drowsiness, pain just under the ribs, and hematuria. Thanks for watching. Like and share. Don't forget to press the bell icon. Follow us on Instagram.